Our goal is to get them back to face-to-face learning. I mean, I think we can all agree that's where we want them to be. So what needs to happen? All right. The first thing that needs to happen is our community spread has to be decreased. I don't know if any of you had the opportunity to listen in on Dr. Memark, who's here from our Cobb Douglas Health Department, as she gave some of the statistics. In June and July, we had about 15% positivity rate for tests. So, basically 15 out of every 100 people, are positive for coronavirus, in terms of extrapolating that data. And we have about now 373 cases per 100,000 people here in Cobb County. And you can go to the Georgia Department of Health and kind of pull up whatever county that you're in. And I'm sure if you're listening in from other states, your own health department has similar structure. Just to give people an idea of what safer numbers are, you want positivity rate to be less than 5%, if possible, before we get them back in school. And you want those case numbers to be kind of 5 per 100,000 or less to really feel confident about opening schools. And it's like a multi-part thing with that, because the more cases you have in the community, then that obviously means that our kids are being infected as well. And so then those kids are going to school and are more likely then to spread the virus to other kids in their class, especially if we don't have the mitigation strategies that we need, like the masking and the physical distancing, which we know a lot of schools, unfortunately, don't have that ability. So that plays a huge part in it, which is why from an adult perspective, like a parent perspective, what can we do? We can do our best to help kind of stop the transmission of the virus by wearing our masks when we're going out, physically distancing, and obviously washing your hands whenever you touch anything that isn't clean. We also need increased testing. Right now, we still have a very long turnaround time when we get tests. If you were to go and get a test now, you may not get your result back for about 7 days. Well, once that result comes back, we've kind of lost that window where we're able to contact trace and figure out, who were you beside and who did you come in contact with, and let's isolate those people. And so it just kind of perpetuates that spread of the virus. So we need to scale up on the testing, and we need to have the contact tracers that are able to call. That was a big part of going to virtual for Cobb County, is when they realized the community spread and the lack of personnel that would be able to follow up on all the schools that maybe would test positive, as we're seeing here outside in some of our neighboring counties. That's a big part of it. And then finally, as we've seen, we go through the surges in numbers where the cases go up, and then there's a lag and you see where the hospitalizations start to go up. And that's kind of where we were also, where we had decreased hospital beds. So we need to make sure we have hospital beds available. And then the last thing that kind of lags from that, after you see the surge, the increased hospitalizations, is you start to see the mortality. So we just kind of have to be conscientious about that. Those are some tips that we can use in terms of the adults to get our kids back into the classroom, face-to-face learning. Some of the things that parents can do is, before your child goes to school, check their temperature, make sure they don't have a fever. If they're feeling sick at all, keep them home. If you know that they've been exposed to somebody who had coronavirus, don't send them to school, keep them quarantined. If they've been tested and you're waiting for the result, don't send them to school. Understand that our decisions, our personal decisions, are now really, really affecting the community at large. And so if we were to send our child to school thinking, it's just nothing, I'll give a little bit of Tylenol, they'll be okay, and then they come back positive, well, then they maybe have infected the other children in their class, and then those children went home and infected their grandmother or their aunt or anyone else who would be considered high risk. So just kind of keep that in mind. I recommend starting a multivitamin. We talked about drinking plenty of fluids, getting that regular physical activity. And those are just some of the things that we can do before our kids even leave our home to go to the school. And then once in the classroom, let's be careful about being, too critical, and try to be helpful with the schools. Talk to your schools, ask them, what can we do to help you as you navigate, the pandemic, as we try to get our kids back in class. Maybe they need help to procure, cleaning supplies. Maybe they just need supportive words for their teachers and staff. So let's just know that everyone is putting forth their best effort to get our kids back in the classroom and doing the best that they can. And we can do our part by being helpful to that.
From a health perspective, but also a mental health perspective. I mean, just the benefits of kindness are so wide reaching that if you can help your kids think about, you know what, there are these other families in our community that this is horribly tragic for, having to learn from home. What can our kids do to help them? It changes perspective for them. It takes just the sense of tragedy away from them. It just opens their mind to what the bigger picture and what's going on. So I think it's helpful to other people, but also helpful to yourself too.
And if you are in any way a part of your school and you're able to help make any of those decisions, some of the tips that we're recommending is cohorting students, right? So maybe keeping a certain number of students in the class, and it's those same students that kind of go everywhere together, so that if anyone were to get sick, it would be from that same group and you could easily contact trace. You also want to work on utilizing the outdoor spaces. We already talked about the decreased risk of exposure to the virus when you are outdoors. So if you have an opportunity to do classroom outdoors periodically, that's a great idea, or bigger spaces, physical distancing, wearing those masks, limiting the unnecessary visitors. And then ventilation is another aspect where the school system may not be able, obviously, to change out their entire HVAC system, but you could discuss how we can better ventilate, keeping windows open when the weather is nice to allow that flow, changing filters periodically. And if you're not already a part of your school's PTA, or if your school has foundations, volunteer, be a part, ask how we can help. What is it that we can do to kind of make this school year the best school year they have, right? We want to make sure that we're entering this school year with a positive attitude so that our children get that as they take it away for the year ahead. And thank you so much for joining us. If you have more questions, please feel free to add them to the bottom, and we will try to answer them as best we can. And until next time, thank you.
Bye.
Thanks, Jess.